it's gonna enable me to do a few things.
You can start whenever, but I'm just going to start the recording
Okay.
because otherwise I'll forget.
Well, welcome everyone. So excited to be here in Cripple Creek at the Aspen Mine Center. Welcome to our Zoom participants as well. Let's introduce ourselves. I'm Bea Babbitt. I'm chair of the Regional Advisory Council. And let's just go around and introduce ourselves.
Okay, I'm new here. It's my first time coming to the RAC. So I'm David Flanagan. I'm the outreach specialist from the Independence Center.
I'm Ted Borden, I'm the Executive Director for Community of Caring here at the Aspen Mine Center.
I'm Maria Cordoba, Outreach Specialist at the Independence Center.
Shannon Conley, Senior Advocate and Aging Mastery Facilitator
Come on in,
at
Bill.
the Aspen Mine Center.
Sorry I'm late. I had trouble getting my bottle sealed up.
Welcome.
You made it.
Trouble was leaking.
Oh, that's fine.
It could be worse. Well, Bill,
Right on time.
yeah, Bill, we're just introducing ourselves, so go ahead.
Bill Bowles from Lake George, Park County.
Wonderful.
I'm Lisa Noble, and I'm the Client Programs Director at the Aspen Mine Center Community of Caring.
Melissa?
Oh, we can see Melissa's hands if you raise them, but I can't see Melissa.
Here I am. So hi everybody. I get to run the technology.
Okay.
All right. And Ted's helping.
Helping or hurting.
Hi, I'm Nicole Walker. I'm the Senior Advocacy Manager here at Community of Caring.
Hi, I'm Dawn Diamond. I am Senior Advocate and the Reassurance Caller here at the Aspen Mine Center.
Wonderful. Let's say hi to our Zoom attendees. Chris?
Hi, I'm Chris Larson. I'm the vice chair of the RAC committee, our Regional Advisory Committee. And then I'm also the chair for the TRS, and I am the representative for Park County.
Okay. Debbie?
Good morning, I'm Debbie Levin-Stankiewicz. It was said before, I'm a fairly new member, but I am also a member of the TRS subcommittee. And I had hoped to come, but didn't make it.
Okay. Eric?
Good morning, I'm Eric Bidwell. I'm a manager within the Department of Human Services and am representing part of El Paso County.
Wonderful. Melody?
Good morning. My name is Melody Hanna. I'm the Program Services and Contract Administrator for the Pikes Peak AAA.
Rosemary?
Good morning, Rosemary Hadamio with the Alzheimer's Association and RAC member.
Is it Lori?
I am Lori Wood, Chief Operations Officer for Silver Key Senior Services.
Welcome. Jan?
Hi, I'm Jen Nemo. I'm with Colorado Community Health Alliance, the Medicaid program for Region 7, also the chair for the Strategic Review Subcommittee.
Kathy?
Kathy Lowry, Executive Director, Teller Senior Coalition.
Great. Michelle? Michelle, can you unmute yourself? I guess not. Okay.
So Michelle is Dr. Michelle Vaca with Community Dental Health.
Okay, thank you. Leslie? Want to say hi?
She's getting there, maybe.
Maybe.
So Leslie, I believe, is with Invita. And oh, she just dialed up on her phone. So the phone is Leslie. So.
Okay. Well, welcome everyone. I'm always excited to come out here to Cripple Creek. I love this place. I don't know. I love the fact that know all your clients. You know, you don't always do that in a larger city. And so that kind of personal knowledge of clients is just, I don't know, meaningful to me anyway, as chair of the RAC. So welcome, we have our agenda. I guess we don't have it posted.
I don't have it up. I'm
Okay.
not good, and I'm not gonna try if that's
Well, then
okay.
we're not-
Everybody has an agenda in front of them.
So people in the room have their agenda, basically the agenda, public comments. We have no action items. We have presentation by our Aspen Mind Center here, our committee reports, and then any discussion items and the calendar. And then we have our minutes from our last meeting. May I have a motion to approve the agenda and the minutes?
I move we approve.
Okay.
10 minutes.
Thank you, Bill. Is there a second? Okay, Mary.
Great.
We have a second. All those in favor, committee members, raise your hand. Okay, thank you. Those opposed? Seeing none, the minutes pass as, the agenda and minutes pass as approved. Do we have any public comments for today?
We do not, but if anyone in the room wanted to share a public comment, I know Aspen Mind Center is actually going to be presenting, but you know, if anybody in the room has a quick public comment, if they wanted to mention
I
something.
will just say that I went to the program on Friday at the area agency regarding abuse and neglect among seniors. It was a really good program. I enjoyed it. It was mostly professionals. It really didn't have a lot of seniors from the community. And I was an ombudsman, so I'm kind of aware of I was a volunteer ombudsman, so I was kind of aware of all the stuff that went on. But it was really interesting to learn how this area is working on trying to solve some of those issues that are going on with seniors.
Thank you, Debbie. Any other comments?
So as we
Bill?
meet, like the Park County seniors are having picnic in the field.
Oh,
That's right.
That sounds fun.
maybe you'll catch that on the way home, huh?
No, it'll be over by.
Oh, okay.
It's being catered by the new barbecue place in Lake George.
Ooh, sounds
I
good.
tasted it, they're good.
I'm gonna try it because I'm close to you.
I was tempted.
Lee, I would like to say something. I just want you to know, Bill, that just because you're in Park County, we can help
I know.
with things. So
I work with,
don't ever think we can't.
no, I work with the Teller Senior Coalition.
Okay, good.
Because I'm 10 miles from the border, 8 miles really. So.
Yeah. So spread it around, you know, we always tell people they need firewood or whatever.
Wonderful, wonderful. Okay, well, let's see. Oh,
Hold on. This is Michelle here. I do have a comment real quick. So I'm Michelle with Community Dental Health. Hi, everybody. I was on the phone. That's why my computer doesn't have audio and whatever. I'm not high tech on my desktop. So, but one comment I just kind of wanted to see if you guys knew about and let you know. Regarding our offices are in the senior center complex, and just reaching out to see if you had seen the news article regarding the closure of the complex. Did any of you guys know anything about this?
College Springs one?
So go
Yeah.
ahead, Michelle, share kind of a little bit about what's going on down there, because everybody's shaking their heads no.
Okay.
Online, I think.
So the whole complex will be slated to be torn down, and at this point, all agencies within the complex, aside from the senior center, will be terminated with their leases in March of 2023. So that will substantially affect a lot of the senior agencies that are here in the complex, including ours. And so we will be, trying to work with the city to figure out, just to see if the city has any idea of the impact of how they're proceeding with the reconstruction of the complex and the time involved with that. But the only thing that will stay in operations in the complex, from what I understand, will be the senior center, while the rest of the complex is being torn down. So there's just a lot of stuff happening over here in our world. So I'll as I find more information out, I'll let you know. If we really do have to move, we're trying to, the other agencies within the complex, we're trying to work together to see if we could all move together and be in one location to continue serving our aging population. And
Is that because they're building a new senior center?
Yeah, they're building a new senior center and building a whole new complex over there. And it may be slated with senior housing, or we don't know. It's been kind of under wraps. So.
And who owns, Michelle, who owns that complex? Is that the city of Colorado Springs?
Yeah, the city of Colorado Springs owns it, but they're working with the YMCA, which has taken over the senior center, as we know, a few years ago. And I believe the seniors or the YMCA received ARPA funding, and so those funds are helping to build a new building for the senior center. So I think that they're working together. But, as I said, I we're kind of gathering together to try and work with the city to let them know, the impact that this is also having on other senior services within the complex, just not just the senior center.
Right. Well, thank you for bringing that to our attention, Michelle. And
can I make a comment? Jen Nemo put in the chat. She wondered is it sounds like there's some possibility, but maybe, eventually that you guys would be able to be in that same space depending on what does get built in addition to the senior center. But again, it sounds like the city hasn't been sharing much detail with you.
They really haven't. I mean, there was talk of it a few years ago, pre-pandemic, and then everything got put on hold, and so they kept extending our lease, and and so nothing was really set in stone. And so all of us in the whole complex were taken aback because the only notification that we received was the article in the newspaper. So, so that was kind of sad on how they handled it. But, logistically, no, if we have to move, and, the cost of moving all of us, and finding a new place, and then the years that it's going to take while the whole complex is under construction, and then to move back, it is not feasible. So if we have to move, we have to move, So that's what, I'm just trying to gather information, and, if we can pigtail, if they would just allow us to, if they're allowing the senior center to still stay in operations, if we, us senior agencies can be, to continue operations like the senior center does, if the feasibility of the construction of the complex, instead of making us move completely. I don't know. It's kind of a an uncertain situation that we're in right now. But we have 8 months to try and figure it out, you know, between whether we can stay or if we have to move and how we're going to move and where we're going to move and the whole economics of it. It's the worst time right now.
Who else is in the complex? What others?
Go ahead.
What other services?
So I know Kelly Optical is one. Rebecca from New Vision is in, and she's one of, I think, our partners. AARP is. There's a hair salon that caters to the aging population. So all of us, there's a lot of people who built our businesses, you know, around the aging population and around, you know, associating with the senior center in this complex.
Well, thank you, Michelle, for bringing that to our attention, and I'm sure we'll try to gather more information and support you in any way we can in the future.
Thank you. Yeah.
Okay, let's move on to our Aspen Mind Center presentation.
Okay, give me a few seconds while I work to pull up the PowerPoint.
All right.
Still in?
Oh, that's right. Are you just gonna be moving it along?
I will. Yeah, but give me a
So while
few.
Melissa's doing that, I just wanted to, there's always some confusion about how all the components fit together. So Community of Caring is the umbrella operation, so the 501c3 over the Aspen Mind Center and now over AMC West, our new facility that you guys can tour after the meeting. So Community of Caring is the umbrella, and so I'm the director for Community of Caring, and then the Aspen Mind Center here is the physical space, and then 100 West, or AMC West, is the other space that now houses most of our client services and case management. So I just wanted to mention that, and just thank you to you guys for coming up. I was talking to Melissa before the meeting, and it's been so difficult through COVID because we're so used to having presentations in the building and visiting, and so it's great to have you guys back in the space here and being able to do the RAC meeting. Again, thank you for your support, for all you do for us, because without your funding and your support, we wouldn't be able to do what we do for the seniors. And so thank you guys so much. And it's a great pleasure to have you guys.
Thank you for hosting us.
Yes, that's right.
All right, so again, I'm Nicole. I'm the Senior Advocacy Manager here at Community of Caring. So we offer 4 services here to our seniors. We have case management, we have a reassurance caller program, a homemaker program. We recently added and run by our Shannon is the Aging Mastery program, which has been a really amazing addition. So here we have our contact information in case anybody wanted to get in touch with one of us. I'm Nicole Walker. We've got Dawn Diamond here, the reassurance caller. Shannon Conley, we've got Miss Shannon, who does more of the intense senior case management. Our goal is to build trusting relationships with clients. We want to collaborate and integrate resources and services, and implementation of proven models and best practices. Mission of Pikes Peak Area Council of Governments assist older adults to remain in their homes by removing barriers to independent living and assist the coordination and development of a comprehensive system of services. So since inception of the case management program, we have served a lot of people. We've served a total of 1,500 roughly unduplicated seniors in our community. So I feel that we've had a really big impact. In the fiscal year of 2021, we served 257 unduplicated seniors. So that's not counting the folks who come back to see us because they need further support. For fiscal year 2022, we served 220. And had about the same hours, so some more people were coming back. Some people we had already seen. We want to help our seniors maintain independence and increase opportunities. We do this by assessing their needs on an individual basis, developing plans of care, coordinating and arranging services. We identify and orchestrate resource activity to maximize independence. And thanks to our many partners, we're able to increasingly provide resources and referrals. COVID impact, we have definitely noticed isolation and depression in our senior population. And actually some of our seniors who quarantined themselves because of the pandemic still had yet to leave their home. So, and I had just a brief case management story for you. So this is the wellness wheel. We use this in conjunction with our self-sufficiency matrix and our client action plan. And we use this to, we try to touch on every single one of these things. We want to get people as well as they can be, you know, as happy as they can be. So one memorable case, I guess, for me was a client, Mr. and Mrs. G. So Mrs. G had lost her job during the COVID pandemic, and as she was looking for, to get a job, she had an accident and couldn't leave the house. And it was going to take a long time for her to get better. This had put a significant financial strain on both of them. They didn't have a ton left over already, now suddenly their income is cut in half. I did a home visit. I went to see them. Their car insurance had lapsed. They had a disconnect on their electric. Their phone service was set to be turned off and they had no food in the house. First things first, with the help of Lisa, she lives near them, so she brought it for me. We got them an emergency food box. We also got them quickly signed up for SNAP for food benefits. And Mrs. G, we got signed up for Medicaid because she, after losing her job, she didn't have any health insurance. So through collaborative relationships with Storehouse Ministries and Help the Needy, we were able to address a lot of their issues and really help them along through her healing process. We got their car insurance policy active, and I think we paid for 6 months, so that gave them a great buffer. We also helped them sign up through Energy Outreach Colorado. We got the disconnect on their electric totally taken care of too. They didn't have to worry about it anymore. Their phone bill was also taken care of, so they were going to be able to communicate with the outside world. And actually their following month's mortgage payment had been taken care of as well. So just a really big hand for two great seniors. We also provided them with a lot of referrals. We sent Mrs. S to the Pikes Peak Workforce Center. I gave them information for mileage reimbursement so that they can save money on gas, and also refer them to the weatherization program because that'll help with their heating next winter. All in all, it was a really great sweet couple to work with. And had we not connected with them, it was the middle of winter. They could have had their electric off, no car insurance, no food, no phone, and just we provided a nice cushion for them, and we were there for them when they needed us. So
great story.
Next up, we have our reassurance caller, Dawn.
Hi, I'm reassurance caller. It's a near and dear program to my heart. I started something similar when I was a dispatcher over in Cripple Creek, and when I couldn't get it to go countywide, Aspen Mine Center, I had done a presentation for Aspen Mine Center, and they jumped in and helped me to do this. So I left dispatching and became a reassurance caller. And anyway, because it's a hard job for me. We served in 2021, we served 72 unduplicated clients. And then so far this year, I have 65 unduplicated clients. We kind of lost quite a few during the COVID, which broke my heart. But, right, my goals right now is to develop relationships with these seniors so that they feel comfortable talking to me, so that they can open up and share when they do need something, so we can get past that pride thing, because, you know, mountain people have a lot of pride. And so we get through that by friendship, you know, and so then they can casually mention to me that there's an issue, and I can get everybody in on it, and we can get them taken care of. I watch for red flags. If there's something I'm noticing about them, I reach out to team members, and we try to figure out what we need to do to help them. I think the benefits are multifold, as you can tell. You know, we work together as a team, and we take care of them and keep them in their homes and keep them safe and keep them happy. So that's what we do. I have a little story as well. I have a couple that were on the reassurance program. They had some health issues. Husband has some heart problems. Wife has many multiple health issues. I started working with them on reassurance, and through that, they had a single child. Their child died during COVID, and depression was significant for this couple. So I increased the calls. I kept that contact with them, and she even reached out to Nicole recently to say that.
Yes, I mean, she reached out to me specifically just to talk about the impact that Dawn and the program have had on her. She's told me that she doesn't believe, she wanted me to know how wonderful Dawn was and how much she appreciated her calls. And she also wanted to let me know that she doesn't think she could have made it without her phone calls, because her daughter passed away. And it was a really rough time. And she just appreciates the program and Dawn so much. She may have had nobody else.
She didn't have
anybody else.
Her mom and dad passed when she was very young. So the only person she has in her life is her husband. And instead of this death in their family causing a rift between them, I stepped in to support each of them individually so that they could keep that bond between them, so that they could vent, they could sound things off of me and not destroy each other in the process of this healing, which everybody knows is very difficult. So the reassurance call helped them through that. And you know, then of course, when they needed help with financial, I could get that taken care of and keep less stress on them through their healing. So our last biggie was, they finally decided that they could put her ashes to rest. So I went with them to be their support system. So it was me and the two of them, and we did ceremony and laid her to rest out here in Cripple Creek so that they can go see, but they don't have to live with that memory in their head. So I think we made steps.
I have a couple of questions. So the reassurance calls are paid staff, or are there volunteers as well?
Right now, it's pretty, we had a volunteer that helped me for a while, and then she had some health issues of her own. So right now it is just me. And I don't have a big thing with that. If we get a volunteer that can help us, we'll be happy to have the help, but I don't let anybody fall through the cracks.
How often do you make calls to your reassurance clients?
It depends on their needs and their wants. I have a few that I call every day to make sure that they have their fall risks or whatever it is. And so I call them every day to make sure they're up on their feet and doing well. And then I have some that I only call once a week. I have a couple that I only call every other week. I set it up to fit their needs and their wants.
Mm-hmm. And how long would you say an average length of a call?
It, that again depends on the person. If there's somebody who's very isolated and needs the, that contact, that human contact part, they may last a little longer. I try to keep them at no longer than 15 minutes. But occasionally we'll go over, and some of them are a quick hi-bye, depending on what their schedule is. I haven't had anybody that ever said, don't call me, I don't like it. So I think it's going well.
Melissa, is it possible for you to put up the different slides? We still have community of this, the first one up there. Is it possible to like go down to the wellness wheel or the reassurance calling program as they're talking about a specific program?
We got them, we're sorry.
They're changing in our room,
Definitely
so we
what
thought
it is,
everybody
yes.
was seeing the
Yeah.
same thing.
I'm not sure.
So
Oh, yes, it's a mouse person.
yep, and I'll let you just sit right here.
Oh,
Okay. Yes, I'm fine. Yep.
We're working on it, Debbie.
Thank you, thank you.
Letting us know.
Right.
Did you say something about the desk? It switches to the desktop.
Yeah, sometimes it switches from desktop one to desktop two.
When I worked at the area agency in Spokane, Washington, they had a very large telephone reassurance program through Catholic Charities, but they had a ton of volunteers.
That's what I'm doing.
So they,
Part of the reason that I like having them talk to the same person each time is so that you can build that
In here?
relationship. So they have that same person and
Mhm.
contact, so they know, you know them, you can tell changes in their voice, you can tell changes in their attitude. And they know you, so they're very comfortable speaking to you and talking to you and knowing that you're gonna be there for them every time.
well, it was the same volunteer that contacted each of the persons. They had a certain number of people that they called regularly, but it was the same volunteer.
Yeah, see,
Oh,
that's
thank you.
it's important.
Can you see it now, Debbie?
Yes, thank you.
Oh, gosh.
So go back a
Can
couple
we
of
go-
slides. Yeah.
Yeah.
Back to the. Just quick enough to let them read it. Yeah.
It's a little easier to follow.
Yeah.
Can you just do the space bar?
Oh, I didn't know you could do the space bar. Thank you. So this is just our contact info and our principles and goals. Case management. Again, we've helped 1,500 unduplicated seniors since the program started.
It's a lot of people.
Build it all down.
Yeah.
Small area.
Right.
This is our wellness wheel. Well, not ours, but we like to use it. Yeah, we like to try to touch base on every single aspects of this wheel.
When developing during intake and developing their client action plan, we try to incorporate every part, all those elements.
It's a great
Thank
idea.
This is the numbers for the reassurance caller program. And it's funny because our number of served people went down, but the hours went up.
Yeah, we haven't gone.
Sorry, I might have even put these years in here wrong. It's like the grant cycle. I wasn't sure how to say that, but the fiscal cycle. Okay.
Sure.
And then we're on to the homework.
Okay. Back on. Thank you, ladies.
Thank you, Melissa.
Well, it wasn't me, but
Okay, thank you.
yes. Takes a village, takes a small town. All right.
So the homemaker program, that's something I head up. It's a self-directed voucher-based program. The seniors who are in need, they find somebody, or oftentimes they'll already know somebody who wants to help them in their home. In the first year that we started the homemaker program, we served 16 clients unduplicated. And we provided 522 hours of light housekeeping and help in their home. The next year, that has gone up so far to 29 unduplicated clients. And we provided about 1,200 hours of help in their homes. But it's really helped fill kind of a gap. It's not perfect because, you know, there's need in Teller County for senior services like in-home and nursing care. So that's hard right now, but it's light housework, no hand-on, no trimming toenails or getting baths or anything. But if that is needed, we refer them out to get those services.
And that is one of our huge gaps in this community is home care aides. We have hardly any, and there's not very many people that provide that service to us. And when we can get them, when we can get them, it's not for a couple of hours per week like some people need. It's somebody who needs like full-time care. And so those are the only ones that we have found that people have been able to get is if they need that full-time care.
That's not just Teller County, that's
I
the
know.
whole rural area.
I know, yeah, we're in the same boat, darling.
Is there a maximum number of hours, like per week or per month, that somebody can utilize?
That really depends on what our budget is each year. What we do is, like this past one, we took the number of clients that we currently have on the homemaker program. And then we broke it down yearly, monthly, weekly number of clients to try to kind of get on the right track for later in the year. We want to make sure that, you know, all of those hours get utilized.
We started at 8. Is this Kathy?
Debbie.
So we started at 8 to begin with, and then we, right now at the next fiscal year, we are down to 5.
That's per week?
No, per month.
Per month.
Not
a lot of hours, yeah.
It's going to be really difficult this next year. Trying to get their needs met. But we are going to try and do we have a little bit of funding from the mine that we're going to try and take the shopping piece out of that homemaker program and try and put it into a plan with, or a program with Keller Senior Coalition. We're going to collaborate, thank you. Collaborate with them. We're going to help people to get their groceries online, because some people can't get their groceries online. And then Teller Senior Coalition can, which they already do, is bring up those groceries to people in our area. So we'll increase their ability to do their job, and we're going to try and make the homemaker hours stretch, I guess.
That's great. That's great.
Try anything once.
So the impacts of the program improve living conditions and well-being. You know, they get someone visiting their house. I mean, they don't get visitors very often or at all. Next up is Ms. Shannon about the Aging Mastery Program.
I was asked to start the Aging Mastery Program and to facilitate it. And it was recently added, 2021 to 2022. I did 3 classes, which were well liked by the community. There's quite a go forward. Everybody's interested in the next one. We did it during our Wednesday meal. We served 26 community members. I like to have somewhere about 9 people in the class. That seems to be perfect, maybe a little more if they'll come. We do it during the meal, so the Wednesday senior meal. So we have it in here. And so they get a meal while they're here, which is always a bonus. And then everybody's outside. It's like, what's going on? They're interested. But the great part is that we used some of our associate members to teach. Exercise in You was facilitated by our Parks and Rec team that does the summer sneakers. We had someone with a nurse from the local school do the sleep. Financial fitness, we had one of our own that does financial fitness. Financial health here at the Aspen Mine, she did that class. Healthy eating and hydration, that was facilitated. I had 2 different facilitators. Oh, this last time it was by a local doctor that takes care of a lot of our clients. Medication management, Solaris Hospice did. Advanced planning, we had beneficent. Fall prevention, we had someone from the Independence Center. Healthy relationships, we had a counselor. And community engagement, we had Ted Gordon. And that was really beneficial, so they could reach out later to these same folks that they got to know during the class. So that really pulled our partners together and made alliances that they could use later, of which they did use later. We have people going to the parking and rec now. We have people looking for long-term advice. Angie's picked up quite a few more clients in her financial health piece. We've gotten quite a few volunteers out of, so if you go back to we don't need to go back, but you go back to that wellness wheel, we've just about hit everything on there with this one class. So that tied in occupation, social, emotional, financial. So that was increased awareness of case management, what we can do here. So a lot of them then come in and say, hey, what's going on? I'd like to see what you all do. If you'd like me to read some of the comments, I am more aware of my medications and how to be my best advocate. So that takes some of the load off of us. These people are learning skills that they can use that usually they would have been coming in to ask us. So coming to the class made me more aware of my physical and mental health. I have made changes in my diet. I started working on my end of life planning. So it's how I choose, because that's something that we work a lot with. We work a lot with end of life planning, how to care what's going to happen to your dogs, what's going to happen to your cat. So we talk about all those things in the class. One lady started her physical therapy again and started in at the park and rec. So, you'll notice, not everyone can see, but there's a gentleman teaching this kind of, he taught some of the class for me, and he's also one of our senior clients. And so now he's working, teaching the AG Mastery or facilitating it, and a member of our community, which he was isolated before. Right. There's a picture of some of our graduates that came to a community tea. So that was I always try and pick an ending thing that is community based. So one went to, this was the community tea, others went to Pearl's Fall, no, it wasn't Pearl's Follies, that just happened to be Elks. Oh, the Victorian tea? Victorian tea. So we try and do the graduation and stuff, and then all these people are friends still. Awesome. So if you want to skip to the next one, and there'll be a video.
Uh-oh.
You got this.
When I first heard about this program, I wasn't sure what it was, but even if it would be beneficial to me. but I decided to give it a try, and I'm so glad I did. I can't tell you how many things I learned in the 10 classes, but I'd like to give you a sample. I came to appreciate the longevity of life. We have so many experiences, and I've come to see them with new joy. And also, just the little things in life, like a beautiful sunset, the colors around me, or the faces of the people in my life. All these I've learned to appreciate. And exercise. I try not to think of it so much as tedious. There's so many different options in exercise. There's sure to be something to fit your lifestyle. Plus, it can make your life longer and certainly will make your life happier and healthier. We had classes on nutrition and hydration and also medication. For example, which medicines don't work together, or even maybe some medicines that react with food. And our financial security class was really good. We learned how to budget and also maybe even find money we didn't know we had available.
I did the aging mastery program at Aspen Mine Center in Cripple Creek. And it was extremely informative. We had great speakers. It was a lot of fun. My favorite parts were learning about how to make myself sleep because I don't do that well. And the nutrition and hydration. There's just so much information I can't even talk.
Hi, my name is Joe Douglas, and I completed the class Aging Mastery Program at Aspen Mines. It was a very informative program. The range of information is incredible. I think that anyone that takes the class will be very happy that they paid for the rest of their time.
That's an old video, but. Yes, that was the first one.
So, how it all fits together. I have some handouts just to kind of share our process and how we work and, you know, try to make things happen as best we can. So, we got the self-sufficiency matrix. We do that with all clients that we see, and then we try to follow up on a regular basis, 3 or 6 months, so that we can gauge their progress as we are working with them. There's also the client action plan. That's the tool that we use to, what's the word I'm taking now? Facilitate to
Options to track.
yeah, it's the plan that we set up for them, and it's nice because you have everything in place and you can keep track of what's done and when you can add things.
See, we can assess their needs, their immediate needs, their long-term needs, and we put it onto that action plan. And then through that, we can make sure that everything is getting all those points that they brought to us, then get hit so that we can make sure that everything gets taken care of. So we use that kind of on all of our clients.
Then we tie it back to the wellness wheel. So all of it's, you know, but it's client driven. It's not us deciding what they're gonna do.
Every one of them is totally different.
Yeah, they can get crazy, but we make it work.
It kind of keeps us out of it and them involved.
Yeah, it keeps them feeling part of it, that it's not just us doing for them, it's them doing for them.
Thanks, guys. I lost my words on that one. So how it all fits together with our 4 programs: case management, reassurance, homemaker, and aging mastery program. We have a wonderful story that Dawn is going to start off for us.
Okay, we started with families, the Jays. They started out on my reassurance caller program. We were referred because the husband had a recent diagnosis of cancer and they were struggling. So we went through and got them into case management. We started their intake, got their action plans, got all that going. And then some of the needs they had were they needed in-home help So we used the homemaker program because they didn't qualify for the Medicaid part of it. We had to get, he needed transportation down to cancer treatment. So we enlisted Invita to help with getting all of that going. It kind of freed her up because they'd leave home early in the morning, go down to cancer treatment. She was tied up there. So she was feeling very frustrated because she couldn't get the things she needed to get done completed because she was taking care of him. So by getting the in-home help, we got her stuff controlled, got him to where he needed to be. And eventually it got to the point that he could actually catch the Invita ride himself and she could stay home and she could get the things she did. It gave her a break. It was kind of like almost like respite camp for her so that she could get some time away. So we kept doing that all through that. Then of course I was still doing reassurance and speaking to them both and keeping in constant contact.
And she was kind of going through a grieving process at the same time, yeah, because she knew that she was losing the life that she had. And so,
and losing her main support. He was her everything, you know.
and they lived out in the middle of nowhere.
Yeah, and they
Off grid.
Yeah.
off grid, they live all over. So, you know, so we gave her support through some programs and of course reassurance. And then we also got him some support and kind of gave them a little break so they could each do the piece they needed to do. And that helped her so much.
So we did end up signing Mr. J up for the homemaker program. So we had a homemaker come out, help complete chores, and it also enabled Mrs. J to kind of take care of her husband and not have to worry about some of the simple things like vacuuming, sweeping, wiping down counters. It just gave her an additional bit of respite too.
And we weren't able to get her signed up for like the veteran services because in our community it's very difficult to get that completed. I mean, it's taken Shannon like 3 years to get this one right. Yeah. So go ahead, I'm sorry.
No, it's okay. And because of the constant contact we maintained with them through the reassurance caller program, we were able to keep abreast of their growing needs and anything going on with them. As Mr. J's cancer progressed, we guided the couple through their choices of care. They decided to recruit the services of Solaris Hospice, who stepped in at just the right time because we were in constant touch. As an advocate, I believe, Dawn, you were her advocate, right?
No, actually,
Shannon,
Shannon
you're an
wasn't
advocate?
that.
Oh, okay. So,
It was, because it was, she did such a
We
good
broke
job.
up this
You guys.
story.
yeah. So as an advocate, Shannon was able to be by her side with the passing of her husband. She even came in and sought help with her budget, final decisions for her husband and grief support.
So then, Ms. J was asked to join the Aging Mastery Program. And this was kind of needed at the time because she needed that social connection and to be around people. So the Aging Mastery was the perfect fit. She accepted the invitation. The class provided her with a needed connection in outside world and got her in touch with peers because they really bonded. All my groups have bonded and became buddies through life. She actively participated. She stated she benefited most from the financial help because her husband had taken care of all the bills. So this was a new skill that she needed to learn. She wanted to know more about long-term care planning for herself. So she got that information, and all my classes, everyone loved the gratitude piece, which was the first one. And it goes through, you know, being great. There's even a deal that you do to be grateful for things that are usually a problem, like maybe incontinence or all these things that you think are just horrible, and everyone thought, "Ooh, why they're grateful." And number one, hands down, the number one class was gratitude. So the final class of Aging Mastery is community engagement, which Ted helps with. And now if you can flip to the next slide. And this is her. And why it says success is now she's volunteering at the Wednesday community meal.
Oh, neat.
It's this huge network, and so we completed the Wheel of Wellness because she's volunteering active social. Smiling and spunky, so thank you.
And I hope that our people on Zoom are seeing the final slide that says success. Debbie, if you could nod your head or shake your head.
No, I'm not seeing it.
Yep. So I apologize because
Okay.
I jumped out to try to put up another screen, and so I have messed that up, but it is a lovely little picture of the gal with her hands up and a success. So I apologize, people out there are not seeing that
But
one.
that is how our puzzle week works together, and we're so thankful for the individual programs that have worked together to make the lives of our clients
better.
We feel like that's our success. Our personal success is the fact that we can pull all those puzzle pieces together and we can make things happen.
So thank you.
So we appreciate you guys as part of our puzzle.
Sure.
So we initiated these programs through AAA, PPACG, through these funds over 10 years ago now. And the amount of impact that has had in the community from the funds and the support from AAA to PPACG has just been amazing. And it's been transformative. We started out initially with a case management program. And we gradually added program after program based on the needs of the community. And so truly it's life-changing for this community. We have more seniors in Teller County than in most other counties in Colorado. So it's tremendously important here. And we take it very seriously, but we also try to have a great deal of fun. So I love this team. I love everything that they've been able to do because truly they just take it on and they take ownership of that program, and it shows in the eyes and in the lives of our seniors. So thank you guys so much for your great work. Sure.
Oh, and one, to finish, she even went one step further, Miss Jay the other day. She donated, we have an intergenerational rock painting after the Wednesday meal, and she was so enthralled with that, she donated and joins in with the kids. So
She actually donated her money to help the children
paint rocks.
paint rocks or whatever, yeah, so it was amazing.
Are the slides going to be online or?
It can be.
Or can you send me a copy?
I'll send you a copy, Bill.
I'd like a copy also, or if you can just send it in an email, I can.
I will.
Out as well.
You're happy with it? Okay.
I switch hats here.
Okay.
Senior village.
There you go.
And I think those additives are handouts. If you guys didn't get them, hopefully we can add those.
Yep.
Right, add those to when you send them.
She's already sent them to me, so I've already got them.
I'll take care
I'll
of that.
send them off, yeah.
I would just like to thank you folks for an absolutely fabulous presentation. I mean, I'm aware of all of these programs, but you just put your own take on them, which is so important. I mean, every single county does these things differently, but you just, you really made it alive, and I thank you for that.
Melissa, can we go back to the member pictures of the members? We just have if you look up there, we're not seeing.
Oh. Yep, she's gonna come make that happen.
Okay. While they're working on the technology, are there any other questions from our RAC members or our guests or our speakers? Are there any other questions?
I guess not.
Well, I just want to say thank you. I think as one of the things I tell people about coming out here is that personal approach that you take and your knowledge of your clients. And I love coming out here because of that, you know, while we keep track of the numbers so we know how far we have to spread our dollars. You also.
And they're never enough to cover everything.
Right, right. And I can see with that gap you talked about in terms of home care aides that, I can see how challenging that would be.
Yeah, we have to be ingenuitive, which we are.
And we have such amazing support from the community. So whether it's volunteers, partner agencies, obviously TSC has been a partner agency since they've been around a lot longer than us. So the Senior Coalition but the collaboration and the integration of services and the people who work together is really a special thing in this county. So it's
And I think that, if I'm not mistaken, the Independence Center actually has that built a ramp in order to.
Yes.
Yeah.
Independence Center actually helped them put the ramp in so that she could, she was in a bad car accident and she was, she basically tells me that, you know, she's more metal than she is bone. And so Independence Center helped us to get a ramp so that she could get her husband in and out and help them get the stairs fixed and the door fixed when the bear tried to tear the door off. The Independence Center helped us get the door fixed. So there's been a million things that we've reached out to our partner agencies as well as internal to help just one family. But we do that over and over, you know, because that's the way it works best is when you pull all the puzzle pieces together.
Well, thank you again. We're going to move on to the other items on our agenda, our membership subcommittee. Rosemary, do you have any information to share?
Sorry about that, trying to unmute. You'd think I'd know how to do that by now. We have no updates as of today.
You have updates or you have no updates?
We do not have updates.
Oh, okay. I missed the word no.
Sorry.
We were all waiting in suspense, waiting.
Okay, no updates. And our strategic review subcommittee, Jen, do we have any updates there?
Not yet at this time. Still waiting on the next strategic plan.
Okay. And so our director's report, I think Melody's going to give that to us today.
Hi, everyone. Hope you can all hear me okay. And I apologize, there's some construction going on down my street, so you might hear that. So I'm going to report out on 3 things. The first one, I wanted to share an exciting update, which is that we have for our 19 providers, all but 2 contracts complete for the new state fiscal year, which I don't know if that's happened before July 1st in years or if ever. So really excited about that and so grateful to this group and to our board of directors for just all of the work and getting things through committees and to our providers, because we do ask them to submit a lot with documentation for insurance and those kinds of things. So I'm just really pleased with that and wanted to see if anyone has any questions about that. I'll move on to the next topic. So we received instruction from the State Unit on Aging for our upcoming 4-year plan. And I think several people in this group know what that is. And for those of you that are new or have been in previous AAAs, the 4-year plan is something that the Administration for Community Living, which is the federal agency that oversees our State Unit on Aging, they require that for us. And it's long-term strategic planning for us. So as part of that, we conduct a survey, and this is different from our performance measures surveys, which surveys each of our agencies. This is a larger statewide one that we'll be conducting, all of the AAAs are doing, and then we'll be doing for our region, and it's called the CASOA. So that stands for Community Assessment Survey for Older Adults. And it identifies priorities and objectives that we need to focus on for the next 4 years. And it really brings into consideration the voice of older adults and stakeholders in our communities and our region. So it's looking at an identification of strengths for our community, the areas of need, how we will use that survey information to inform our 4-year plan, and how we can not only collect that information, but disseminate it across our region. So to our different providers, other people that we network with that are not necessarily providers, but how we can make that information accessible to them as well. So the last one was completed in 2018. And if any of you have a curiosity about seeing what was conducted the last time, I can get that sent out. It's also posted on our C4A website, which is all of the AAAs within the state for Colorado. So at our most recent C4A meeting, which is the meeting for all of the state directors for AAA, there was a vendor that presented to us that we'll be partnering with, and they are a civic communications and analytics company. And so they do this for all of the AAAs for our state. So they presented details about the survey, including survey questions, a timeline, and then new content that will be covered that wasn't covered previously in the last CASOA. So that new content we're really excited about. It includes questions about economics and workforce, inclusivity, community design related to housing and new urbanism for areas in the state that have urban areas, and we're one of those, communication and technology. So really taking a look at how older adults are able to access technology and then also how they're utilizing it. So this month, we're working with that company. They're called POCO. We're working with them on draft mailing materials. So they already have the questions formulated, but then really to localize that with our logos and making sure that we're explaining adequately to those older adults and households that receive the survey, the purpose, the intent of the survey, how we're going to be using that information. So those will be distributed starting in mid-July through the end of August. And then from September through mid-October, Polco, the vendor, they'll be doing their analysis and all of the fancy things they do with that data to compile it and really make it usable. And then they'll give us a final report on all of that by late October.
The surveys will be mailed, or are they email, or?
Yes.
And how did you use census data to get the names of seniors in the area?
They use a combination of census data and then also our database of older adults.
Great.
So they're doing a combination, and that's a great question. They're doing a combination of surveys that will be mailed out, and then they're also making sure that they have email ones. They're doing a full survey packet in an envelope. They're sending out postcards. They're doing a variety of different ways to make sure that we get as much sampling as possible.
Great.
So Melody,
yeah, go ahead.
This is Melissa. And so I'm curious, the last CASOA that went out, it was, I don't know how many pages, and the print was like 7-point font. And Maria is reminding me that it was how many pages? 86 pages.
The survey itself was 86?
No. Okay. No. Okay. She's looking at the 4-year. She's looking at the 4-year plan.
Oh, okay. I was going to say I've seen the survey, and I know it. I don't think it's that long.
It is. It was multiple pages, but the font was really small. So I wonder, and I know everyone talked about that last time. So I wondered, is this company addressing that issue, and what are they doing? Do you?
They didn't mention that, but I will certainly bring that up because they're going to be sending us the draft materials for review. So I'll ask them about that, and because I know that they were talking about making sure that, like, on our websites or the email survey that was going to go out, to make sure that that was an adequate size font. So we'll make sure that it is as well for the paper surveys.
Okay. Great.
Good question. Any other questions about that? So as part of our 4-year plan, which I mentioned we received instruction for, and that will be due to the state on March 31st in 2023. And that covers the state fiscal years from 2024 to 2027. We also conduct community conversations as part of that. Were any of you involved in the community conversations last time? Does that sound familiar? Okay, so these are public input meetings. So we'll be conducting at least 3 of those and in each of the counties so that we can get input from older adults, local government officials, key informants, basically anybody who is interested in providing input on our services to older adults. We'll conduct those and hope to partner with our providers to hold those and to make sure that we're holding those in each of our counties. So I don't have any hard details yet about when those will be occurring, but as we're planning those, we'll be sure to reach out and let all of you know as well when those will be occurring. And they're really, the survey is very formalized. It has very formal questions, and the community conversations is meant to be more informal and to be smaller groups of people so that, you know, when you're in a larger group of people, sometimes it's hard to get everybody's voice, or sometimes not everybody is comfortable sharing. So we'll have kind of an informal but still guided conversation to try to get input back from people about the needs that they're seeing in their community and how we can use that information to have real actionable items for our 4-year plan. So as we get more details about that and solidify that, either Jody or I will be sharing those.
Do you usually have RAC committee members participate in presenting during those? During
the community conversations, we certainly have them participate. So I don't know in the past if we've had RAC members present anything. There may be, I mean, certainly a short presentation on here's what this is, here is who the AAA is if you haven't heard of us, here's how we're using the information, here's why it's important. The community conversations that I've had at another AAA, we definitely had RAC members participate and to try to reach out to people to invite them to the community conversations as well.
Great, thanks.
Yeah, thank you for that question. Any other questions about that or the CASOA? Okay, well, if you do think of anything after you've had a minute to noodle on it, definitely feel free to reach out to me via phone or email, and then we'll just be sharing information as we get that nailed down. Thank you all.
Thank you, Melody.
So I'm going to add a few more words to Melody's discussion there. I'm going to sit over here. Sounds good. So I just wanted to share a few more pieces that Jody had asked me to let folks know about. So Maria was speaking a little bit about last week in Colorado Springs. It was a busy week. You know, Silver Key had their senior summit. And then the day after that, the State Action Planning Group had their Future of Aging conference in Colorado Springs. And so there were folks on Zoom in the Zoom room, as well as in person down there. And then, of course, on Friday, then it was World Elder Abuse Awareness Day event. But what I wanted to just mention a little bit about, I don't know if anyone on Zoom or in the room was at the SAPCA conference besides myself and Maria. Anybody else at the SAPCA? And so what they really talked about at the State Action Planning Group meeting from the state level was the reauthorization of the Older Americans Act for the state of Colorado, which went ahead and then formalized the State Commission on Aging to continue and to be funded and to be housed. And they moved it under kind of a different leadership structure. And they're going to be reappointing new members to that State Commission on Aging. And so if you wanted to, you know, consider being a part of that, maybe reach out to me. I didn't bring that contact information with me today, but they will be reappointing new members from all of the judicial district, all of the elected, all of the districts across the state are going to have appointed members. And there's a couple of elected officials at the state level who are already eyeing being on that committee, which is really exciting. Two of them were at the conference last week. Representative Mary Bradfield, who's from Colorado Springs, and Representative Mary Young, who's from kind of a district on the northeast side of Denver, I believe. And so it's exciting to see that they're going to be able to continue a lot of the state level leadership and really wanting to bring in local input and making a difference. It's also nice to see that the state and our governor and our leadership at the state level really are valuing aging. That was, I think, the biggest message and big takeaway from that. Governor Polis had a recorded conversation, a recorded presentation. It was a little generic, but it was still great that he took the time to do it. His senior advisor, Jared Hughes, did an amazing job. He is such a strong advocate for all things aging, and he just did a great job talking about the importance of recognizing what we need to help older adults age in place across all of the state, not just in our urban areas, but everywhere. So that was really good. And so stay tuned if you're interested in the State Commission on Aging. We also have our local, for the 3-county area, Commission on Aging, which a lot of people don't know about because the RAC kind of gets all the attention because most people know about the Regional Advisory Council, but we have a State Commission on Aging that meets out of the Council of Governments. And if you're interested in that, let me know. We are looking for representation across our 3-county area. Right now, the Teller County representative is Paula Levy. So Paula is on the commission, so you guys can always be talking with Paula. The Park County representative is Commissioner Amy Mitchell. So we do have, but we're always looking for additional members and especially members who are over 60 for our local Commission on Aging. So I wanted to get that out there and let people know. And Jody was actually one of the presenters at the Senior Summit, which was great, talking about the AAA services. And then we also had Invita and Laura Cruz, our mobility manager, presenting on transportation. And then at the World Elder Abuse Awareness Day, Kent Matthews, our family caregiver support person, he did a great presentation to close out World Elder Abuse Awareness Day. So a busy week last week, and hope that that kind of inspires folks to keep doing all the really good work that we heard about today. So thanks, everybody.
Thank you. Thank you. Any questions for Melissa? Melissa, just for information, how would you say the Commission on Aging differs from our RAC, our Regional Advisory, this committee?
Yeah, so the Regional Advisory Council, the purpose of it is to monitor and guide on the services that the Older American Act funds. So, from the dental services that Dr. Vaca provides, the transportation and everything with Invita, everything you guys are doing. So the RAC is responsible for looking at that $6 million and saying, how are we making sure that we're providing the right services? What are the gaps? How do we make a difference? Putting together this 4-year plan so we have some type of direction that we want to move in, having that all kind of, some good eyes and watchdogs on what happens. So it's not just myself and Melody making it up as we go along every day. We really are, responsible to the community and the region, and especially older adults themselves. So the Commission on Aging is a much more broader focus. The Commission on Aging is looking at, what are the policy and advocacy pieces that need to happen at a local, regional, and state level to make lives for older adults better. So the purpose of that commission is to really be thinking about what types of policy and legislation needs to happen. And honestly, the Commission on Aging could be advocating with our city council on behalf of what Dr. Vaca brought up today, her concern about, it's great that they're gonna keep the senior center open during this construction process, but these other senior services, are really in jeopardy. And so there could be opportunities for the Commission on Aging to hear that concern in Colorado Springs and share some conversations back with our city council members in Colorado Springs. So really the commission is more of a broader approach and could potentially lead to actual legislation and policy change at different levels. And hopefully, you know, ideally interacting with the State Commission on Aging a lot. So we did not do that at all this past year. There was not a whole lot of interaction with the State Commission on Aging, but the local Commission on Aging hopefully will get there. So does that help?
Thanks. It's, you know, when you have two commissions, you want, or two groups, you wonder
what's what,
who's doing what, and, you know, and in terms of volunteering to serve on those committees and so forth, the question is, which focus do you enjoy, you know, as a CEO?
Sounds like I need to talk to Amy. She's a neighbor only 2 miles away. So. And my commissioner.
Yeah.
Wonderful. Yes. Sometimes we don't know who the person is that we should be sharing our concerns with. Yeah, absolutely. Well, thank you, Melody and Melissa. We appreciate.
I'm gonna have you switch the.
Yes, thank you.
Update. And in a recent.
I know. Oh, there you go. You're moving it.
In a recent conversation with Jody, he did mention, I just gonna bring this to Jen's attention. He did mention that as the plans for the 4-year plan come about, that then our strategic review subcommittee will be the place where we'll have those conversations and the input from the RAC on that 4-year plan.
Right.
So just let you know about that and let other RAC members know about that. Once again, there will be an opportunity for members to participate. We'll let you know when those meetings will be, and of course, any and all members are welcome to participate in those meetings. As far as my chair report, I simply want to, I wasn't here last month because lo and behold, after 2.5 years of avoiding it, I got COVID. Hard to believe. I went to my first public, I went to a Tri-Lakes Cares, which is our northern El Paso County service center for seniors, well, for the whole community. Anyway, I went to a fundraiser, 300 strangers. And ended up getting COVID, even though I have the vaccine, even though I have the booster, but I didn't get that second booster yet. And that's probably my own fault for delaying on that one. But anyway, so I've been out of commission a little while, about 10 days with COVID. But I did want to just refer back to something that you reported on last month, Melissa, in terms of the food basket delivery. I know that was a great success, correct?
It was.
Do you want to just maybe a repeat a little bit of last month, but since I didn't hear it, I wasn't even up to getting on Zoom.
So one of the pieces that one of our past RAC members commented on as she left the RAC was that our RAC, and also concerned about serving older adults, you know, what were we doing to reach out to people who are in marginalized communities and people of color? And so the RAC and the Commission on Aging started, but then they started to go off in another direction, put together a committee that started talking about how to better serve communities of color and communities who are really low income. And it kind of ended up being focused a lot in El Paso County. So we had a committee of folks and, you know, met, and the idea was also, might we find some additional RAC members as a result of doing this work too. And so then, and the RAC member actually had said, I want to do something around food and feed people culturally relevant food. What does that look like? So then we had Leadership Pikes Peak, which is an organization in Colorado Springs. They approached us and said we would like to volunteer and help with the project. So they did. They helped us get together a bunch of food. We did outreach to different communities, and we did a food distribution to about 150 older adults in Asian, African American, Latino. We also did kind of what we called, white culture, if you look at kind of going down the list when you're checking off ethnicities. So we did have food that, we had folks that showed up that did not fit into those particular cultures and they wanted to participate. We had some food for that as well. And so we did that distribution in Colorado Springs out of Centro de la Familia. We will be doing another food distribution during Hunger Action Month in September. And so, we can potentially talk with our two other counties and see if we wanted to do something up in our other counties as we get ready for September. But it was wonderful. The food for the most part was gone by 10:30. We did have stragglers coming in all the way up until 2 o'clock. B actually picked up some of the food from Natural Grocers in Colorado Springs and helped get it delivered over to the location. And we were bagging food until 8:30 at night, the night before, with all the volunteers, but it was wonderful. So, and lots of connections with older adults. We have all of their contact information, calls of reassurance to reach out, but no potential RAC members as a result of that. But at least got food out to older adults who were really grateful. And we had some people who said, I want an Asian food bag. Or I want a, Hispanic food bag. So we had a little bit of crossover, which was kind of fun. And so anyway, it was good. It was really a neat project, and it really was spearheaded by Cynthia Aki, who is a past RAC member, and Joe Ruth, who's a current RAC member. So it was wonderful. And I was sad that you had to miss it because B's been part of the planning all along. And then when it came to the day of giving out, B was out of town. That's all right.
Right. Well, thanks for that. And I think that I was just so excited about that project and the planning and, I don't know, quite a few months of planning to pull that off and see it happen. And I think over time, I hope it helps us understand our various communities in terms of their attitudes toward seniors and how do families, what role does family play and what role do community service organizations play in meeting the needs of seniors from different communities. So I'm hoping that we learn a lot through this process as well as meet the needs of these various communities.
And there's another food distribution in September.
Yes, have not set the date for it, but it is going to happen in September. It'll probably be middle to late September. I don't know that we'll kick off September with it because I don't know that there'll be enough time to plan. So it'll probably be mid, but.
Okay, are there any discussion items that our members want to bring to our attention? Hearing none, our calendar of events, our next meeting is July 28th, and that will be back at the office. And as usual, we have our executive committee meeting. That's our officers and committee chairs on the first Wednesday at 1 via Zoom. Are there any other events that people want to bring to our attention? Rosemary?
Hi there. We actually have our veteran caregiver series starting on the 30th next week. It's a 6-week series. It is virtual because it's statewide. We partnered with our veteran caregiver team. And so there'll be information on Alzheimer's and dementia and then veteran services, all the way from accessing them and what kind of services to death benefits and also some exciting programs that they have as far as programs that they that our veterans can access throughout the state for our local, what do we call those? Our local,
VSOs.
not the VSOs, so they can access like parks and stuff like that. So that's kind of exciting because there's a lot of stuff out there that they can do for free. So thank you.
And who do they contact?
Yeah, if you're interested, you can contact me directly. You can just reach out to me at 719-372-5977.
And that will be on Zoom, did you say?
This will be on Zoom and it's 6 weeks.
6 weeks, okay.
Trying to get your attention.
Chris.
Okay, Chris?
Hey, I need to add something that I had forgotten about. We had about a month and a half ago, we had pretty much decided to not seek any grants to help with funding for our studies for transportation. The numbers that we're going to wait and see, there's actually 2 active studies right now. We're going to wait to get those numbers as we more or less be spinning our wheels. We pulled back from that. And then I am helping Joyce Whittle move to Arizona, and it has been currently all of her stuff is in a truck. I had to literally leave day before yesterday because they keep delaying her closing on her house. So Melody, Melissa, if you guys can give me contact information for the Phoenix AAA, what would be involved? She's in the Sun City region. I would really like to reach out to them and see if I can get her any help. I mean, it's just eating her money, staying in a hotel. We've got the truck sitting there full of her furniture. I mean, it's been kind of a pretty big nightmare. So if y'all could give me that contact information, I'd really appreciate that.
Sounds good.
Thank you.
And Debbie.
Yes.
Were you in Phoenix?
What was that?
Were you in Arizona?
No, New Mexico.
Okay, all right. I need to travel to those 2 states more. All right.
Okay, any other announcements, events? Anything coming up here in Cripple Creek?
We're having the veteran, I don't know what it's called, the veteran salute to being an American on 4th of July. There's gonna be music and dancing and food and all kinds of great stuff.
That's a community-wide event.
Community-wide event for open to everybody in the world.
There you go.
Yeah, and so it's on 4th of July, I think, and there'll be, there's something else, fireworks. I don't know if you've ever been to Cripple Creek fireworks, but they are probably one of the best fireworks in the world.
I can see it from my front window around the corner of the mountain.
And you can feel them, you know, this caldera just keeps that, it echoes and you can feel
the fireworks. That
Yeah,
sounds
it's
fantastic.
amazing. Yeah.
Sounds great.
I actually do have something too. Our marketing department is still working on all the information for it, but on July 15th, from 11:30 to 2:30 at the Independence Center, we're having the ICU, the Independence Center is Best Able, like best
cool.
ABLE. So it's just gonna be a big open to everybody festival basically, and we'll provide information about what the Independence Center does. It's gonna be fun information, but once I have more information, I'll send it out to all of you.
Absolutely, let us know about that. I'd really like to participate.
Definitely.
What was the date again?
It'll be Friday, July 15th, from 11:30 to 2:30.
Any other announcements?
I brought with me, and I'm going to leave some with you guys in case folks up here are interested. So we have kind of July off for classes from the Area Agency on Aging, but starting in August, we have the Medicare series starting again via Zoom. And then we also have the Retirement series available via Zoom starting in August. And so I'm going to leave flyers up here for folks to share. The really interesting thing is these Medicare webinars are now all recorded, and you could watch any of them at any time on YouTube. If anybody has somebody that's got Medicare questions and you want to kind of tune them into a series of things, oh my gosh, they can just go watch a YouTube of it. But to do one in person where it's live and you can kind of ask questions, there is a benefit to being there in person too. But just know that it's kind of interesting now to know that we've got all these things recorded in perpetuity. But again, we do still run them live. And if people wanted to jump in and, you know, kind of be in person and have some interaction, those things are coming up in August. And so that's my update. All right.
Terrific. Anything else? Well, I think that's it for today then. Thanks so much for everybody attending and for participating, presentations, information. And we'll see you next month, July 28th. So with that, I will adjourn our RAC meeting for today. Bye now. Bye, everybody. Love it. And it's so interesting that you get the same reaction the first time they hear you present, you know, that I had the first time I came up here, you know.
So for some reason, the mouse is disconnected. I wonder if when we, how could that be? Is yours a touch screen by some chance too? Okay. There we go. Ah, thank you. Lovely.